Hello everyone, my name is Mohd Saad and welcome back to Dot Line Academy, and today's topic is scapula. So we'll study the anatomy of scapula, and this lecture is also available in Hindi, so if you prefer Hindi आप description के through Hindi में lecture देख सकते हैं. Okay, now coming back, we are studying scapula and its anatomy. So first of all we should know that how we will identify whether the scapula we are seeing from the anterior side or from the posterior side. Okay, so scapula is a flat bone, okay, flat from anterior side and flat from posterior side, but there are some peculiarities, okay, some peculiar structures are there which identifies whether it is from the anterior or from the posterior. So you will see this thing, a spine of scapula, okay, also called spinous process. It is a structure present at the posterior side of the scapula, okay, and from the anterior side when you see the scapula, let me show you. Okay, so you will not see the spine of a scapula and it is plain from the anterior side. Okay, so the thing that differs the anterior to the posterior is the spine of scapula. Now coming back to the posterior side of scapula, we should know about the angles. Okay, we have studied about the surfaces. Now coming to the angles, there are two angles, superior angle, inferior angle. Okay, where they are present? Here it is inferior angle and here it is superior angle. Borders, there are three borders of scapula: superior border, medial border and lateral border. So these processes that you see in the scapula are at the lateral side. Okay, so this border of the scapula is the lateral border and this border of the scapula is the medial border, and the superior border of the scapula will be the superior, medial and lateral. This is superior border, this is lateral border and this is medial border. Now coming to the processes, now we are going to study about the processes. So there are 1, 2 and 3 processes: acromion process, coracoid process and spinous process. First I will tell you about the spinous process. This is spine of scapula. Here this part is the spinous process. Here you see this part is the spinous process. Okay, this part in continuation to the spinous process that extends out from the scapula laterally and forms a bigger part is acromion process, and the other process that is at the anterior side, which you can see from the posterior side also, is coracoid process. Let me repeat. So there are three processes: acromion process, coracoid process and spinous process. Okay, the acromion process, the spinous process, is the spine of a scapula which you see at the posterior surface of the scapula. The acromion process is the extension of the spinous process, and the coracoid process is another process, shorter, smaller, but at the anterior side. Now we see the scapula from the anterior side. Okay, it is scapula from the anterior side. It is anterior surface. Okay, it is the coracoid process. It is the acromion process. Another special structure that is present at scapula, it is glenoid cavity. Okay, let me change the color. Glenoid cavity, its function is that it articulates with the humerus bone, okay, and forms the shoulder joint. shoulder joint. Okay, here the shoulder joint is formed, and one another joint is also formed that forms with the clavicle. Okay, the clavicle and this bone, this scapula bone, forms a joint here, that is acromioclavicular joint. JT means joint. Okay, two joints are formed. I repeat, one joint here with the glenoid cavity and the humerus forms the shoulder joint, one joint here at the acromion process forming the acromioclavicular joint. Let me show you the real photos of it. So here you can see the shoulder joint as well as the acromioclavicular joint. Here is the acromioclavicular joint and here is the shoulder joint. Okay, this humerus forms a shoulder joint at the glenoid cavity. This is the glenoid cavity, and this acromion process forms at the acromial end of the clavicle forms the acromioclavicular joint. Okay, now one thing that is very important, so let's take another photo of the scapula. We are seeing it from the anterior side. Okay, and at the superior side of the glenoid cavity here is a glenoid tubercle, and here is the inferior glenoid tubercle. It is superior glenoid tubercle. Okay, so superior glenoid tubercle and inferior glenoid tubercle, these two tubercles are having some importance, because this superior glenoid tubercle, at the superior glenoid tubercle, the long head of bicep is inserted. Okay, it is the insertion point of the long head of bicep. Okay, and at inferior glenoid tubercle, it is attachment of long head of the other sep, the tricep muscle. Okay, here the tricep long head articulates and here the bicep long head articulates, so they have some significance. Now all the things are clear, and let me show you all these things in a concised image. So here in this image I have marked all the structures that I've taught you today. Okay, so you'll find the link in the description. Download this image from there, and thank you very much for being till now. So with that we end this video. Thank you very much for being till now, and please like and subscribe my channel for further medical lectures. My name is Mohd Saad, signing off. Take care.